aim of this review is to provide a comprehensive overview for non-dermatologist clinicians outlining skin cancer diagnosis, treatment pearls, and skin cancer prevention strategies as they relate to solid organ transplant recipients. My name is Layla Tolamat. I'm Assistant Professor of Dermatology at Mayo Clinic in Florida. The title of our article is Skin Cancer and Solid Organ Transplant Recipients, a Review for the Non-Dermatologists. It'll appear in Mayo Clinic Proceedings. The takeaway message of the article is that the support of non-dermatologists is essential in the prevention and treatment of skin cancer and solid organ transplant recipients. Solid organ transplant recipients are at increased risk for the development of skin cancer compared to the general population. This requires consistent monitoring and management from a multidisciplinary team. A comprehensive search of the literature was conducted through the Medline database. Over half of solid organ transplant recipients will develop skin cancer at some point in their life, most often non-melanoma skin cancers. Organ transplant recipients are at risk for worse outcomes, resulting in increased morbidity and a skin cancer-specific mortality that is 9 times higher than that of the general population. The most common malignancy seen in solid organ transplant recipients is cutaneous squamous cell carcinoma. That is a 200-fold increase compared to the general population. For squamous cell carcinoma, poor outcomes defined by local recurrence, nodular metastasis, and disease-specific death are frequent among solid organ transplant recipients with advanced tumor stage. Treatment strategies commonly employed for squamous cell carcinoma include reduction of immunosuppression, destructive procedures, excision, and Mohs micrographic surgery. For those with locally advanced or metastatic squamous cell carcinoma, a multidisciplinary discussion involving dermatology, head and neck surgery, and surgical oncology helps determine the most appropriate resection strategy. The radiation oncologist will guide the plan and administration of adjuvant or palliative radiation. Input from medical oncology is essential for managing systemic treatments. Melanoma and rare cutaneous malignancies, such as Merkel cell carcinoma and Kaposi sarcoma, are also more frequent among solid organ transplant recipients. Strategies to prevent skin cancer development in this population include patient education on photoprotection, regular skin checks, modification of immunosuppression, and treatment of precancerous lesions with appropriate destructive techniques. Chemoprevention may necessitate monitoring of multiple organ systems in a multidisciplinary fashion. While dermatologists ultimately treat and manage many cutaneous malignancies in these high-risk patients, an understanding of skin cancer risk, development, and management is important across all members of the patient care team. This shared responsibility is especially heightened in communities with limited dermatology access, as primary care may assume responsibility for skin cancer prevention and screening in these situations. This finding relates to clinical practice as the number of solid organ transplant recipients increases. This becomes a larger proportion of our patient panels. Clinicians outside of dermatology can be proactive in ensuring that patients are keeping regular dermatology skin cancer screenings. They can also provide needed education on the appearance of skin cancers, self-skin checks, and photoprotection. For patients, this means that skin cancers can be detected and treated early. Similar to other skin cancers, if this is the case, we can decrease morbidity and mortality. Next steps for research are investigating skin cancer from both a prevention and treatment aspect. For treatment, immune checkpoint inhibitors are possible options when traditional treatment approaches are not feasible. However, checkpoint inhibitor therapy comes with the risk of allograft rejection, and so further study is required to determine how to best implement these medications. For prevention, Novel vaccines that offer cross-activity against carcinogenic HPV types are under development and may help to prevent development of squamous cell carcinoma in solid organ transplant recipients. In addition, oral supplementation with omega-3 fatty acids and topical therapies such as T4 endonuclease lotion is being investigated in the prevention of non-melanoma skin cancer in solid organ transplant recipients. Thank you so much for your attention. I invite you to read the article that will be upcoming in the Mayo Clinic Proceedings. Please feel free to review the article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.